Hi everyone, today we're going to be talking about a very important topic that has been making headlines recently. It's known as
human metapneumovirus,
or you can also call it HMPV for short. In this video, I'm going to be covering everything you need to know about this virus, from what exactly this virus is, how it is spread, the signs and symptoms, and how you can prevent you and your loved ones from contacting this virus. So let's dive right into the topic. Hello everyone, welcome back to my channel. If you're new to my channel, I am Nurse Dean and I am a registered nurse. In today's video, we're going to be talking about
human metapneumovirus,
or you can also call it the HMPV. In the course of this video, you will hear me mentioning HMPV instead of human pneumovirus. HMPV is a respiratory virus which has symptoms that are similar to common cold and flu. You might not have heard of it before, but HMPV is a virus that has been for decades. Some people dated it back to 2001. Now, what exactly is this HMPV? It is a virus, a respiratory virus, and it belongs to the respiratory family of Paramyxoviridae virus. Now, this family has other viruses, which includes RSV, which is respiratory syncytial virus, and also parainfluenza virus. How does it spread? HMPV is a virus that can be transmitted through droplets, which means when an infected person sneezes or coughs in a particular environment, there is a likelihood that people whom came in contact with those droplets can contract this virus. Also, it can be transmitted by touching of contaminated surfaces, just like I said, when those droplets come in contact with a particular area. If you are in contact with such surface and then you let's say you touched that particular surface and then you touched your eye, your nose, or your mouth, there's a likelihood that you're going to be contaminating the HMPV. Based on research, it is estimated that the incubation period for this virus is between 3 to 6 days and is mostly active during the later winter and the spring seasons in temperate climates. Now, how does this work? When you come in contact with the HMPV, maybe from a droplet of an infected person, what it does is that it attaches itself to host cells, which are mostly located in the respiratory tract. And this can be done through its interaction with certain proteins, such as the glycoproteins, interacting with heparin, sulfates, and so on and so forth. Now, when this interaction occurs, HMPV induces response with chemokines, cytokines, and macrophages, which causes inflammatory response in most cases and gives room to those signs and symptoms that are involved with the HMP virus. Who and who can this virus affect? This virus can affect everybody, from a child to an adult. It can affect everybody. However, it is more severe when it attacks a certain age, like the infants or younger children, the older adults, that is the elderly, and also the immunocompromised individuals, such as probably individuals that have HIV or one disease or the other that is affecting their immune system. What are the symptoms of HMPV? Like I mentioned earlier, in mild situations, this HMPV possesses symptoms that are common or similar to symptoms of common cold and flu. In situations like this, the individual can possess signs and symptoms such as cough, headache, fever, nasal congestion, or even sore throats. But in severe cases, the individual can suffer from symptoms like bronchiolitis, pneumonia, or even difficulty in breathing. This HMP virus are more common in seasons like the later winter and the spring season. Treatment. How do you treat HMPV? There is no specific treatment for HMPV. As at the time I made this video, there is no specific treatment for this virus. However, you can manage these symptoms with medications that can be used for treatment of those symptoms that I have already listed. Also, you have to encourage yourself to drink enough water so that you can stay hydrated in seasons like this. And also, try as much as you can to boost your immune system so that it doesn't worsen your situation. Now, let's talk about prevention. How can you prevent your loved ones? How can you protect yourself and your loved ones from contaminating the HMP virus? Hand hygiene. You have to wash your hand frequently with soap and water for at least 20 seconds. Because we already know that this virus is a droplet virus and you can get it from contaminated surface. So which means if you touch a particular place that is contaminated, then you need to wash your hand so that you can wash the virus off your hand. Also, make use of alcohol-based sanitizer, just like we did during the COVID-19 season. Avoid close contact. Now, I said avoid close. I didn't specify it to avoid close contact with people that are already infected with the virus, because there is no how you can detect who is already infected with the virus. So it's advised that you avoid close contact with people so that you can prevent the risk of this droplet transmission from when maybe an individual mistakenly sneezes in a room. Now you see that if you were not close to such individual, there is a likelihood that you've prevented yourself from getting whatever the person has, not just the HMPV. Disinfect surface. I encourage you all to try as much as possible to clean surfaces with using soap and water, and also your rag. You clean those surfaces like the table, the chair, the door handles, and anything that you feel like someone else can also come in contact with. You make sure you clean it regularly and thoroughly. Wearing of nose masks. In places which you feel like are overcrowded, it's advised that you use your nose masks. This is going to help in reducing the transmission of this HMP virus. In summary, human pneumovirus is a virus that can affect all ages, although it is common to infants, the elderly, and people that are immunosuppressed. Remember, staying informed is the first step towards staying healthy. Therefore, if you found this video educative and informative, don't forget to like, share, subscribe, and also turn on the notification button for more health-related content. See you all in my next video.